At some point, if you're still dealing with fatigue despite doing the right things, you're eating well, you're sleeping as best as you can, you're managing your training load, you have to stop guessing and start measuring. Because there's only so far you can get by adjusting variables when you don't actually know what's going on underneath the surface. And that's what today's video is about. Hey, I'm Dr. Jason Barker. I'm a naturopathic doctor, I'm a two-time Ironman, and I've worked for 20 plus years with endurance athletes. So when it comes to lab testing, I approach it differently than a standard medical workup. I'm not asking whether a value falls within a reference range. I'm asking whether it's optimal for someone placing the kind of physiological demands on their body that endurance training creates. That's a meaningfully different bar, and it changes what you find. So let's walk through some specific labs I look at and why each one matters. The first area is iron status, and this requires more than a basic iron panel. Iron is foundational to aerobic performance. It's the functional center of hemoglobin for oxygen transport, of myoglobin for oxygen storage in muscle tissue, and a required component of the cytochrome proteins in the mitochondrial electron transport chain. Iron deficiency impairs oxygen delivery and mitochondrial energy production simultaneously, which is why low iron hits endurance athletes so hard and so broadly. Now here's something critically important that most athletes, and frankly most doctors, often miss, and that is ferritin is not included in a standard iron panel. A basic iron panel typically measures serum iron, transferrin, and sometimes total iron binding capacity, or TIBC. Those markers tell you about iron in circulation. Ferritin tells you about iron in storage, your reserves, and that's the number that matters most for endurance performance. You can have a completely normal iron panel and a significantly depleted ferritin. That athlete is functionally iron deficient in the way that matters for performance, but the standard test doesn't catch it because ferritin isn't part of what was ordered. So when I evaluate iron status, I run the full picture: serum iron, transferrin saturation, total iron binding capacity, and a ferritin, separately and specifically requested. And the ferritin threshold matters too. Many labs flag anything above 20 or 30 as normal. But in practice, I routinely see endurance athletes with ferritin in that range who are fatigued, underperforming, and recovering poorly, because that level isn't sufficient for what endurance training demands. For performance, I'm generally looking for ferritin above 50, and in some cases closer to 75 to 100, depending on the athlete and their particular symptoms. The second area is B12 status, and the standard B12 test frequently misses the problem as well. B12 is essential for red blood cell production, neurological function, and DNA synthesis. It's also a required cofactor in the methylation cycle, which affects everything from energy metabolism to neurotransmitter production to recovery. When B12 is suboptimal, you'll see fatigue, cognitive fog, reduced performance, and impaired recovery. But here's the issue. Serum B12 is a notoriously unreliable marker of functional B12 status. The blood test measures total B12 circulating around in the blood, but a significant portion of that can be bound to proteins in a form that's biologically inactive and unavailable to your tissues. You can have a serum B12 that looks perfectly normal while your cells are functionally B12 deficient. The better marker is called methylmalonic acid, or MMA. Here's the simple version of why it matters. Your cells use B12 to break down a compound called methylmalonic acid as part of normal energy metabolism. Now, when B12 is insufficient at the cellular level, that breakdown stalls and MMA accumulates in the blood. So elevated MMA is essentially your cells signaling that they don't have enough functional B12 to do their job, even when the standard serum B12 test looks completely normal. It's the difference between measuring what's in the blood and measuring what's actually working inside of the cells. For athletes, I always run an MMA alongside serum B12. That distinction is clinically significant and frequently changes the picture. The third area is cortisol rhythm, and a single cortisol blood draw tells you almost nothing useful. Cortisol isn't meant to be static. It follows a precise daily arc, peaking in the early morning to support alertness and energy mobilization, then gradually declining throughout the day so the nervous system can shift into parasympathetic recovery mode by evening. Now, that rhythm is essential for both performance and recovery. When it breaks down under chronic training stress, you get the wired but tired pattern. Flat and fatigued during the day, but unable to wind down at night. Sleep becomes less restorative, recovery becomes incomplete, and the whole system gradually loses its ability to adapt to training. A single cortisol blood draw gives you one data point at one moment in time. It cannot show you a rhythm. What's actually useful is a multi-point salivary cortisol test, typically 4 samples collected across the day, morning through evening, that maps the full diurnal pattern of cortisol. That's what allows you to see whether cortisol is chronically elevated, whether it's blunted or flat, or whether the rhythm is inverted. Each of those patterns has a different physiological implication and requires a different intervention. The fourth area is vitamin D, which functions more like a hormone than an actual vitamin. Vitamin D receptors are present on virtually every tissue in the body, including muscle tissue, immune cells, and the gonads, the testes and the ovaries, meaning vitamin D influences muscle function, immune regulation, and hormone production, including testosterone, of course. Deficiency is extremely common, particularly in athletes who train indoors, those who train in northern latitudes, or training heavily in the early morning or evening when UV exposure is limited. For endurance athletes specifically, low vitamin D is associated with increased injury risk, particularly stress fractures, impaired immune function, reduced muscle strength, and lower testosterone. The standard reference range considers anything above 20 nanograms per ml as sufficient. For athletic performance, I'm looking for levels between 50 and 80 nanograms per ml. That's a significantly different target, and a lot of athletes fall well short of it. The fifth area is thyroid function, and this requires a complete panel, not just a TSH or thyroid-stimulating hormone. The thyroid regulates metabolic rate, energy production, body temperature, and recovery, to name a few. When thyroid function is suboptimal, even subtly, athletes experience fatigue, weight changes, poor recovery, cold intolerance, and cognitive slowing that can be easy to attribute to overtraining and stress. The problem is that most standard workups only measure that TSH, that thyroid stimulating hormone, which is a pituitary signal, not a direct measure of thyroid output. TSH can look normal while actual thyroid hormone production is suboptimal. A complete thyroid panel includes a TSH, a free T3, and a free T4. Free T4 is the primary hormone produced by the thyroid. Free T3 is the active form, the one that actually binds to receptors in your cells and drives metabolic effects. T4 is converted to T3 in peripheral tissues, and that conversion process can be impaired by chronic stress, nutrient deficiencies, and high training loads, even when the thyroid itself is functioning adequately. So an athlete can have a normal TSH, a normal free T4, and still have insufficient free T3, meaning their cells aren't getting the active thyroid signal they need. You only see that if you measure all 3 of them. And the sixth area is a comprehensive micronutrient panel. Individual nutrient tests give you specific answers to specific questions. But what I find most useful for athletes who want a complete picture is a comprehensive micronutrient assessment that evaluates a broad spectrum of vitamins, minerals, amino acids, and antioxidants simultaneously. The one panel I use and recommend evaluates nutritional status across a wide range of markers, including fat-soluble vitamins, water-soluble vitamins, minerals, amino acids, omega fatty acids, and antioxidant capacity. What makes it particularly useful is that it assesses functional nutrient status rather than just circulating levels, giving you a more accurate picture of what's actually available to your cells and tissues rather than just what's floating around in the blood at a given moment. For athletes dealing with persistent fatigue or performance issues that haven't responded to the obvious interventions, this kind of comprehensive assessment frequently identifies those gaps that targeted individual tests would probably miss and gives you a more clear, prioritized roadmap for what to address. So to bring this all together, if you're dealing with persistent fatigue and the basics haven't given you answers, these are the labs that are worth running. First one, a complete iron panel with ferritin that needs to be ordered separately, serum B12 alongside methylmalonic acid to assess functional B12 status at the cellular level, a multi-point salivary cortisol test to map the full daily rhythm, vitamin D with a performance-oriented target range, and a complete thyroid panel including TSH, free T3, and free T4, and a comprehensive micronutrient panel for a full spectrum picture of where the nutritional gaps are. This is how you move from guessing to knowing. And when you know what's actually limiting you, fixing it becomes a much more direct and efficient process. If you want this kind of testing with interpretation through a performance lens and a targeted protocol built around your results, visit naturalathleteclinic.com. That's exactly what we do. Please be sure to hit the like and subscribe if this was helpful. I post science-backed content on performance and recovery regularly. I'm Dr. Jason Barker. Thanks for watching, and I'll see you in the next one.